All right. Hello, and let's get into this next case. It's a really fun one. So Scarlett comes in and she's got a little bit of a history. Scarlett is the daughter of a hygienist who works for a dentist in my town who does not refer to me for whatever reason. So Scarlett was told by her dentist that she should see the orthodontist. She went. The orthodontist that she saw gave her a recommendation that she should wait on ortho until she was ready to have jaw surgery because she was a complex vertical case. Scarlett's mom didn't really accept that, so then she brought her to see me. I gave her a second opinion and told her that we would be able to use some bone anchors and use our lift technique, which is 4-tad intrusion, and be able to treat this case pretty simply. At least that's kind of what we told her. So the funny part about this is, you've all had these cases where Scarlett comes in and her mom, even though she works for the dentist that we're not going to be working with, she asked us not to even communicate with the dentist. She didn't want the dentist to know that she was going somewhere else, which I really wonder about that. Like, how does that play out? I mean, eventually the dentist is going to see Scarlett and realize that she wasn't seeing that orthodontist. And, funny enough, even after we treated Scarlett so beautifully, we still never saw any patients from this dentist. So, you really can't really fix all the problems in the world, but we can fix one, and that was this young lady's bite. So let's get into this. So you can see that she has a typical vertical maxillary problem, right? We go through this in our courses where we talk about the vertical component. She has over-eruption of the first molar, autorotation of the mandible, increased mandibular plane angle, increased lower face height, increased vertical thirds, lip incompetence, mouth breathing. I mean, this is just a slew of problems that occur when you have vertical issues. So we really, really wanted to make sure that we gave her a solution that addressed that issue. We didn't want to just put on braces, wear class 2 elastics, and try to stretch all this together. You can see it's reinforced with this pen. There's just contact on the first molars. And in review of the lift procedure, so our lift protocol, which is load-induced force technique, it's a very common procedure we use for our vertical case management. We have 4 steps to this. The first is placing 2 8mm vector TADs on the buccal, typically between the first and second molar, but in her case, because she was mixed dentition, you kind of have to choose wherever you can get the TAD in, whether it's just distal to the first molar or just mesial to the first molar. It doesn't make a difference as long as we can intrude the teeth. And I believe in this case, I put the buccal TAD on the distal of the first molar, and I put the second TADs, which is the palatal TAD, on the mesial of the first molar. And the reason I did that is because if you draw a line between the 2 TADs, it's going through the center of the tooth. So I'm still getting a fairly straight intrusive force. Step 3 is to place your buttons on the palatal and then use the braces on the buccal. And step 4 is to load induce the teeth with C-chain. Again, 1 link of closed link C-chain gives you 60 grams of force, which is pretty ideal in a case like this. So you'll get a nice vertical force vector that intrudes the tooth. Again, this image is for when you have second molars and first molars. You can see in her case, I wouldn't have had the second molar, so I would have had a TAD moving from the wire to the C-chain from the TAD to the wire. And on the palatal, I would have had just 1 C-chain from the button to the TAD. So you can see that from beginning to end, we're able to easily manage this young lady's problems and really reverse all of the vertical issues that led to these downstream problems, right? Just by doing one simple procedure to treat the vertical, we can solve multiple problems that would have made this case even more complex if we wouldn't have treated it or we would have treated it improperly. And the beautiful thing is it took 13 months. So let's get into this case. Phase 1 is where we go through our round wire phase. So in Scarlett's case, we put on the braces, put some bite stops on. We did start vertical elastics because she had a reverse smile arc due to some tongue issues and breathing. So I wanted to erupt those anterior teeth a little bit. At the same time, I set her up for an appointment 2 weeks later so that we could put on the TADs and start beginning to intrude those first molars. You can see just 4 months later, she's got the TADs between the second bicuspid and the first molar, and on the buccal, it's distal to the first molar. You can see that's a pure intrusive force. I don't have to wait until I get it to a bigger wire. I can just start to intrude. And just in 4 months, you can already see back in the posterior that I have the first molars off the occlusal plane. The only thing touching is the second deciduous molar on the right, and then the buccal occlusion on the left is nice. So we wait 1 more visit. And now she's fully socked in the anterior. You can see that I don't need to tie the TADs anymore. I've solved the main problem in this case was the vertical. So just by intruding the molars, we've closed the anterior open bite, auto-rotated the mandible, improved the class 2, increased and fold the forward chin position, decreased the lip incompetence, and really have just really knocked all of these downstream problems out so that it's a very straightforward class 1. So let's go through the first 6 months of treatment. Again, 014, upper and lower vertical elastics. We placed our TADs, went 018, 14, 02, 75. So phase 1, we're using the braces, which we use Damon Ultima, to solve the tooth alignment issues, and I'm using the TADs to solve the vertical problem. So now phase 2 essentially is what we normally do. We are going to go to our full expression phase where we put in our 180275 NiTi. That's going to give us axial and torque control, and we're going to maintain the vertical. So you can see now that we've got all the teeth in the system. The torque, tip, and angulations look great, and we've got the TADs removed. So this case is really getting set up to finish already. Phase 2 is straightforward. Again, 180275 copper NiTi. We did reposition and did a little bit of equilibration in phase 2. And then again, we're continuing in those 334, 3.5 ounce, 3/16 elastics. So phase 2 comes to an end, and we end up moving to phase 3 in just about 4 months or 5 months later. You can see everything looks great. Her smile's nice. It's developed. We really had a beautiful outcome here. And again, 4 months. So 180275 steel over 160275 steel, and we continued the elastics to finish the braces a week later and have a beautiful result. And yeah, we didn't finish with second molars, but we had her retained with Essex molar to molar, and then we put her on 6-month recall. And when those second molars erupt, if they need any help, we'll help them. If not, we really want to make sure we cover them with the Essex right when they come in so that they don't cause another open bite issue. But you could see just how brilliant this case turned out. She came to us with this idea that she was vertical, and she left really growing in a normal fashion. If we go ahead and we look at the before and afters, you can see how remarkable this case actually turned out. Again, some pretty major vertical issues, beautiful overjet, overbite, first, second, and third order are dialed in. We even have a little bit of wiggle room in that first molar where it's still a little bit off the occlusal plane, which I'm fine with, especially in an open bite case. That will find its way home, especially when the second molars erupt. Again, everything turned out beautifully. Treatment time, 13 months. And if we really look at this, one of the things I want to show you in her case is just really what we're looking at. Eventually we're going to get these the third molars out. These second molars will find their way. But let's look at the profile change that we were able to accomplish. You take these vertical cases that have that long face syndrome, and you're able to beautifully auto-rotate that mandible back in a counterclockwise rotation, bring the chin forward, decrease the lower face height, and restore facial thirds so that, what was once off becomes absolutely stunningly beautiful. And you can really not turn a blind eye to these vertical problems, because now we've truly treated this in a way that satisfies the aesthetics of this case. We all know that if we would have put class 2 elastics on, we would have auto-rotated the mandible in a clockwise rotation, erupted the lower molar, and made this case even worse. And it would have just been that much harder to treat with surgery later on. So again, 13 months, really have to look at kind of how easy this protocol is. The lift protocol of lifting the molars up with 4 simple TADs can't be any easier. It takes 10 minutes of our treatment time. And as you get good at it, it's just beautiful. So Scarlett was treated start to finish, 13 months. We're really happy. Again, if a case like this, if it gets you excited, please let us know if there's something else you want to see. Check us out on our socials, forward these cases, make sure that you share with your friends, because again, I'm trying to post these cases and give you a behind the scenes look on how we treat them for the pure goal of allowing everyone to be able to treat these cases just as easily and just as well as I've learned from my mentors. So hopefully you enjoyed and have a great time with this. All right, take care. Bye-bye.